So I want to thank the company who is just supporting you to be with us. I think it's going to be a good, collaboration and a kind of start of very fruitful, the friendship. Also knowing each other, what we are doing. Please be relaxed because, we are not just organizing this, event to say or to lecture you. This is a kind of an event because we want to share everything with you. It's like we have lots of innovative data in our hand, but we want to share with you. The main idea is, the novel techniques or novel information you will be learning while you are here. So we are a really very busy clinic. We are having something like, 150 cycles around per month. So it's just including everything that we are doing. We are going to share with you what we are doing. Okay? So we want to thank all of our staff and the supporters because we are just not only this building or this center. We have another center in Istanbul, in the Eastern University. Just we are moving towards the eastern part of the Turkey. There is a city, I don't know, maybe the Urfa. You heard about it. It's just in the eastern part of Turkey. It's closer to Gürgan. So we are just setting up the system there. But this is a kind of a state-of-the-art system. We will have the sun chains and we'll have the opportunity to share all of the information that we have here with our just, the other centers, sister centers. So we have, now something like 6 clinicians in our system, very well educated and trained. You are going to meet them. So we have just 8 embryologists trained and well educated, and each of them are very expert, but they came from different centers, different the areas, and they put their expertise all together to produce the better the production, which is baby. So I think please feel free to ask it to us and to share. You are not going to learn from us only, we will learn from you. So as the Monser Ben Khalifa is the laboratory science, international laboratory director, I want to thank him. He came from Paris, he's a professor in Paris, so we wanted to share his information because we are publishing lots of things all together, and he is very expert in Europe, and also he knows the Arabic, and he did it. I think you didn't talk yet the Arabic, huh?
Later, for the question.
Okay, so, and even if she said that it's written very well here, I don't know, but it's something.
So this is the first time.
Emotional, eh?
This is the first time when we see something Arabic now.
Yeah, but this is.
No Arabic words at all, only this one.
Okay, so anyway, we are sharing, so I'm going to sit down here. So I will be a little bit quick. What we are doing is just, we have a new concept. Please take the concept while you are here. So think about that. This is the concept, is the balancing concept. Balance. Even if you think your, the family, your country, our religion, even if the Quran is saying to us that balance the things. Everything is unbalanced, you are not going to reach to the goals, to help the people, to help them to have the baby, but the balancing is going to be something not for us. We should balance the different things to be more successful. So I'm going to give you a highlight during the first, presentation from now on is going to include everything that we are going to share with you in the today and the tomorrow. Huh? So we agree that the balancing is just very important. Huh? So if you don't balance the technology, technology is not balanced, it doesn't work. Yeah? So, what is coming here? Ha? Nasıl gidiyor çocuklar? Evet. Bilmiyorum da çalışacak mı ablacığım? Şuraya mı basacağım?
Evet.
Tamam. Okay. So, and the question is how we are going to maximize the pregnancy rates, which is very important here. So usually when the patients are coming to us, what they want? They want the baby. So they want baby. So we should talk about that, what we are going to talk. We are going to do this one. But the important thing, if you are running a kind of a clinic, it should not be only the academical success at, yes, should be the maximum pregnancy rate. But on the other hand, we have to think about the pregnancy rate and also abortion rate, about the pregnancy follow-ups. At the end, we want a healthy baby. But if we don't, provide the health care and all the proper techniques or the relationship, communication, physical atmosphere, and providing the health care very openly, and they are not going to understand usually what we are doing, because there are lots of information is coming from the Google and the communication with the friends. I know that in Turkey it's nearly the same, because our patients are not easy like the Europeans or the USA people, because in the USA people come to you and you say, okay, pregnant or not pregnant, try again. But in our countries they are emotional, they come to us, and because they have very big impact on their psychology, social life, marriage, relationship. So when we are doing something to a group of the patients, even in our country or the cities could be different than the others, or the economical status, social life, the relationship in the marriage. And sometimes I know in Iraq, I was in Dubai and Qatar recently, and the people are coming to us, even in the Urfa that we are doing, is different than the Ankara and the Istanbul. Because people and the ladies coming to us, I want a baby. How old are you? 45. Oh my God, what are you doing? So you see, okay, why you are so late? You are questioning, but they say, I'm not so late. I have 4 children, so I want the 5th one. So you say, my God, what are you doing? So, but this is the social and a kind of tradition or understanding of life. So that's why, we have to think about that. The main problem is for us, the dropout rate. If we don't give the people or our customers or the patients the right treatment option, they go out. Means that after 1 treatment or 2 treatments, and they say, okay, it's enough for the psychologically, the burden of the treatment or the economically, they go out. Even if they could get the pregnancy themselves, but they are out. This is I think the worst scene for us in our religion, to push the people out of the treatment, not to condemn them, not being having children, because they go. big information. The science came to a kind of a, the boundaries. It was before, when the first baby born in 1978, only one baby, just now 10 million. Because lots of techniques, lots of new information came to our hand in the lab or the clinical side, so we know that we cannot jump now. It was before the pregnancy rate was something like 10 to 12%. Now we are just talking something like 40, 45, or sometimes 50, 55, or sometimes 15. So we are just having the different percentage of the pregnancy depends upon the personal information of the individual, of the couples. So sometimes the patient are calling to you to ask, what's your pregnancy rate? Surely the people are saying 80%. Welcome. 80% is good. But nobody is saying the truth. Anyway, I want to tell you something, because in this fertility treatment cases, we are having a very bad experience. What is it to you? This is the losing the respect. You know it? Respect. They lose or they don't respect to the IVF centers or the treatment, because they are questioning us all the time. They come to us, oh, I saw something, this is something, and please give me 80% pregnancy. And sometimes the patients in the clinicians are saying that, okay, this is the most beautiful blastocyst I have seen in my life. Okay, I'm putting it in, and you are just pushing the brain of the couples to going up. So pregnancy is going to come. If you push too much and they lose too much, they go up and they jump down and they go. So this is a kind of a very big responsibility for us while we are doing something. Because I tell you that, because patient is asking, is simple, it's easy for you, eh? Easy, economical, devoid of the complications, and successful. It's easy. They come to us like this. Please give me my baby. It's going to be easy. It's going to be no money and something. I open the, the close, and you get to each one baby. But this is the understanding of the human beings. And I'm just saying to everybody while I'm lecturing, the art is the art. Because it is really, it's a kind of a understanding the sperm, oocyte, embryo, helping, and the responsibility, and the family things, and healthy baby, and the economies. How we are going to balance it? So we have to take care of each of the part that is going to provide the negative or the positive information or the impact on our, the work. So you are just starting, and even if you put the injections, and this is the injection, how many injections that you are going to give, how much you are going to give, the complication, if you give too much, is going to be two problems. Maybe in the PCO or the high responders, you are going to put the patient in the dangers of the ovarian hyperstimulation. So, but on the other hand, if you give and you are going to make the companies happy because they're spending the money, but they are just spending the money. Our patient is from their pocket. We are not a rich country, eh? So we have to be very careful. But yeah, another important thing is I told you that I don't know what's in Iraq, but in Turkey we don't want to increase the multiple pregnancies too much, not the baby bombing. So another thing is the ovarian hyperstimulation that you are going to listen to us. So this is a very risky thing. So sometimes when we are doing too much in the lab, too much like we are talking about transferring the blastocyst, it's good. blastocysts. Are we selecting the really good embryos? It's possible, but when we are putting the gametes out of the, the body for a certain period of time in the medias or with some chemical, we could have some kind of effect which could be developed after a period of time, after years, to our babies, which is the epigenetic problems. So I can tell you that this is a very important area. People think that take one sperm, put an egg inside, and it's a technical thing under the microscope without taking care of anything. It's happening in Turkey too, because we have something like more than 150 IVF centers. If you go to the education, training activity, and the teamwork activities of the individual IVF center, nothing is happening. Only welcome, how old are you? Sometimes they are asking, and how is your period? When? Day 2, day 3, okay, oh welcome, start the injection next day. So we are not doing it. This is the balancing concept. We have to orchestrate the system with the right people, right time, right drugs, right information that we are having. We have to provide the people, okay, the individual. This is the individualization, the system. But everybody is talking individualization. So we are going to show you today what we are doing. So it's a summary, and we have to, the quality of the gametes are important, embryos are important, but importantly, we forgot for a long period of time, there is another very important area, which is endometrium. Everybody is talking about how is your embryo? Oh, good quality. How is your blastocyst? Oh, very good. And if you put the embryo into the very badly prepared endometrium, which is not good, like Dr. Ziya Kalem is going to show you soon in a minute. So if it's not good, you put the embryo, destroy it. But another important thing, you have to be very careful with the embryo transfer technique, that you are expert on that. If you could find the time, and when we are doing embryo transfer you could see it. And another important thing is the baby cannot come if there is no successful pregnancy. We have to, prevent, if it's possible, the increased miscarriage rates. So if there are repetitive or the miscarriage, there is no baby. So this is a very important thing that we are showing in our system. Is a balancing system. There should be a dialogue in between the cells, organs, and the systems and the people. This is the very important things. The couple, clinician embryologist, cumulus cells that you are going to listen, oocyte, sperm, embryo, endometrium. And at the end, the fetus and mother, obstetrician, single healthy baby. It's easy, huh? No, it's not easy. Because you will see that this is the balancing paradigm. Maximize the beneficial effects of the treatment, minimize the complications, and individualization of the ovarian stimulation, high quality gametes and embryos, endometrial receptivity, and the balance everything. So how are we going to choose the best? So to get the best results. So you see that if we have the very good patient, young patient, you could get 60% pregnancy rate. But nowadays, especially in our clinic, very difficult patients are coming. Very difficult, because we are the reference center, all of the person coming in, there are lots of problems. Even if they are psychologically disturbed, they are aggressive. And after 5 unsuccessful pregnancies, they are coming to me, to Miberanum, to Ziya, or to me, and they want to kill us. You say, I didn't do it. You are coming from the other centers, I thought, please sit down. Because this is something I'm going to tell you later on when I lecture in Qatar, because we are the, the Islamic country, and people are just talking. We have a panel there, and one of the lady talked to me that, okay, we are the IVF scientists, we are giving the hope, and also we are giving the babies to the people, and God is going to support us. We are very good in front of the, the God. Maybe we are going to go to heaven because we are helped them to give the baby. I say, no, it's not the case. I think the best, maybe the reward can come because we are suffering too. They take the baby going out. If they are coming back with no baby, unsuccessful pregnancies, they push us. They make us unhappy. We have to help them, and we have to make them to believe in the system, not to let them to go, and it's going to be it's going to be rewarded. So at the end, if we could believe that, so this is the balancing concept, and all of them should be balanced. So when we are just coming that, if the patient's mind, the couple information in between them is not good, unbalanced mind and the brain and the body is going to cause a problem. And believe me, it depends upon the individual, is going to be decreasing nearly 20 to 30% of the pregnancy rate if they are coming with the unbalance and the fear, afraid, aggressive, or the psychological problem. The another thing is the sperm. And you are going to listen. Because if the sperm is not good enough, the fertilization is going to be a problem. There are lots of problems in our system now, and the sperm, oocyte, embryo, endometrium, and at the end, we have to balance the center. We have to balance ourselves. If we are not ourselves, and the balance, if the nurses are fighting to the embryologists are very aggressive and they don't like each other. They are just not entering to the love in a friendly manner, and the clinicians are just pushing them every day, and they don't get the money enough, and they are just like it's unbalanced. And this is really the patient feeling, and we know that actually in the recent information as given to us that the obesity is increasing. Cigarettes, smoking, alcohol consumption, endocrine problems such as the thyroid, PCO, and the stress, and the fatigue, and lots of things are happening, and it may cause the success rate. So, at the beginning, you are going to read that the surgery from the reproduction, you will be hearing soon, because any problem can cause the infertility, and also it may affect the pregnancy rate, because we have to decide not to operate everybody. So you are going to listen what we are doing to prepare the people just before the IVF treatment. Sperm is going to talk or to discuss, because sperm is just genetics. Nowadays there are lots of information just in our hand showing that nearly 50% of the pregnancy loss or some kind of IVF treatment failure, or in fact it is coming from the male side, and there will be some techniques in our hand like IMSI or bifrequency, polarized microscope, or the chip technology you are going to hear during this workshop. So another important thing is the female age, or the decreased ovarian reserve. So it is really very, very big headache for us, and there will be new technologies just now, and we are going to talk to you, and even if the PRP or what we are doing in our technology. And I don't think we put lots of things for the control ovarian stimulation. Maybe we could think about that question and answer. So the ovarian stimulation is very, very important for the IVF success. We have to, divide our patient depend upon their, the response to the ovarian stimulation. Why in our clinic we don't start the, the treatment. They come to us, we listen to them, we make a kind of a new test. We call it the tube test. So we have to include in this system what they need to be tested, not to everything to them. So for the, there's some thyroid problems, or there's some kind of hormonal things, immunological test, or some kind of physical problems like a operation, they need it or not they need it. After that, they have a kind of scoring system, what should be done in advance, and we have a kind of a system showing that how we could help them. So it needs usually 1.5 months just before we try, we start for the treatment for them. We don't jump in it. It's very, very certain, 1% of the patient. So, and IVM in our center, we are doing the in vitro maturation if it's needed, but you know that we are the first in the country who had the successful pregnancies and the deliveries in the country in vitro maturation. Usually, if it's needed, we could use it for the PCO cases or some experimental, technologies. And we are doing the oocyte activation for some cases. In the lab, you are going to get the information. For the endometrium, and we are just making a kind of test to find out if there is any problem in the endometrium, immunology and whatever. We are going to show it. If they need the support to the endometrium, so we could help them to do the things. And we just started. It is not the case, but we are going to do some stem cell work to overcome the problem of the Asherman syndrome or the endometrial atrophy. So for the stem cell, using in the endometrium to injection, if it's going to help them, because there's a paper coming from Spain show that they could put the stem cell, endometrial stem cell in the endometrium, and they produce the endometrial cell line. But now we have another system that I'm going to tell you that we are just using the PRP or the endometrial injury or the immune modulation of the endometrium if there is a kind of an endometrium inside the uterus to make it better. So you will see it. So, and you will be hearing, I think, the system for the cryopreservation of the gametes, oocyte, embryos, and also sperm. And recently, some experts from Turkey is going to discuss with you ovarian tissue transplantation. So at the end, we will be giving you the how to evaluate the embryos. So we have the embryoscope. Maybe you heard it. If we could find it, how the oocyte fertilize the embryos are going, how to select it. But at the end of the day, we personally believe, and in the European, the data is showing that if you want to use it, you could use it, but it doesn't make too much, difference for the pregnancy rates. But it's a kind of academical things. If you have money, something extra at €100,000 to look at the oocyte, and you could. So at the end, you will be hearing something at the PGD, because how to do it, I think in the Arabic countries and this kind of technologies, urge to the people to do it. Make the genetic testing for everybody. We don't leave them. It's nothing. So, but if you select the right people, right person, right techniques, because it's causing lots of economical burden to it. So this is the balancing tool. We call it the balancing for the genetic balancing. So at the end, you may be hearing that, genetic balancing is embryo is getting better, and on the way that we are going to go to the, the regenerative medicine, there would be the, some stem cell research is going on. We could produce a kind of a germ cells from the stem cells. But we have a new technology for the premature ovarian failure patients, which is called the hyposignaling disruption and the activation system for some kind of the premature ovarian failure cases in our hand. It started to work, and we produced some follicles and the eggs to be fertilized, but there is no pregnancy in our hand yet, but we are working on it. So the technology is getting really a new era. So maybe in the 5 to 10 months, years in time, there will be everything is going to be automated in the laboratory, and today's technology is not going to be the tomorrow's technology. It's going to change. So we should be ready for the tomorrow. So it would be just now we are selecting the best embryos. Maybe in the future we will be selecting, not selecting, we are producing the best embryos, one embryo transfer and one pregnancy. It may be common. So this is end of my, the presentation. The last thing should be, we should be, very careful, because if we do something now for our patient, and we have to, there are lots of information accumulating in the science showing that IVF maybe could be in some way in the lab causing the diabetes mellitus or some kind of, maybe I tell you that the cancers and whatever. So we have to continue our, our studies and the scientific work to find out if it is the